Killer, baby. I want to thank Dr. Lou for reminding us about the American dream and not to take what we have in this country for granted. Thank you so much for reminding us that. Now I'd like to bring back to the stage Dr. Box, Jim McClelland, and Paul Jarris. Got enough chairs up here? Okay. What do you think so far? Think things are going okay?
I think you're doing a great job, Barbara.
Well, we have some questions, and the audience is going to ask you some questions, and it can be thrown out to anyone up here, you know, about where you think we're going to go with this conference today. How much are we going to accomplish? Is it possible? I mean, do we have the wherewithal? Do we have the great thought to get across what we're trying to do here today? What do you think?
Absolutely. I think the people of Indiana are the most amazing people that I've met around the country, and I think that they have the heart for unborn children and our pregnant moms, and for the American dream, for every child. When you have children, when you've been a parent, even when you haven't, you know that you want to give every child the best chance in this world to get an education, have a career, have a family, and have a happy and blessed life.
Amen. Well, one of the questions from our audience is, what is one of the most cost-effective things states can be doing to address the opioid epidemic? Jim, you want to answer that?
Prevention is the most cost-effective from the standpoint of long-term results, long-term impact. We need to do a lot more on the prevention side.
When you say we need to do a lot more, we always talk about what we can do, but how do you get it started? How do you get people revved up to do what we got to do?
You know, I think that the experience that Iceland has had over the last 20 years is instructive. In the mid-90s, that country had one of the worst problems with substance abuse among its young people of any country in the world. And they decided they had to do something about it. And organized at a municipal level, and they took several steps. And one of the most, I think one of the most impactful was providing an array of opportunities for young people, after-school opportunities, to do the kinds of things they were really interested in, to learn or enhance skills, art, music, dance, sport, to get them engaged in something that gave them the natural highs. They got them with kids who had similar interests, maybe not the same kids they would have been hanging out with on the streets. In many cases, they ignited a passion. The kids were able to focus their energies on something that was instructive. And from 1998 to 2016, the percentage of 15 and 16-year-olds in that country who had been drunk within the previous month dropped from 42 to 5%. The percentage who had ever smoked marijuana dropped from 17 to 7%, and the percentage who used cigarettes on a daily basis dropped from 23 to 3%. And one of the best ways I've heard this described is what they did was create a culture among young people that was built around personal growth and development that could compete effectively with a culture of getting high. We can do that in this country, and it can be done at a community level.
Oh, cool. Dr. Lou, you have something?
Yeah, I'm going to jump in here. In public health, there's a model that we use about how to bring about real social change. And you really need three things. You need knowledge base, you need social strategies, and then you need political will. Right? So we have the knowledge base, we have social strategies, and from what we've heard and from what we've seen today in this room, I think we have the political will to get it done, and I'm optimistic that Indiana will get it done.
Amen. How about you, Jarris?
Yeah, so community prevention does work, and in settings we're talking about substance abuse, rarely does prevention get mentioned. It gets mentioned as in educating doctors, preventing overprescribing, but there are important things to be done at the community level, and SAMHSA does support some of these. Michael, do you remember what SPIF-SIG stands for? But these strategic grants to communities to organize and engage with young people. And when I was Commissioner of Health, all the different units used to come in and talk about community prevention. And I failed to realize they're all doing the same thing. They just do it by different topic. You want kids with opportunity to be employed or engaged in meaningful activity. You want connection to the community. That could be civic organizations, school, sports teams, their church. You want engagement with a family. And studies have shown that children who have dinner with their parents at least twice a week have lower rates of substance use and things like that. So this is not something we would take on in a healthcare setting. It's not something we'd necessarily take on as an opioid initiative, and nor should it be, because it prevents truancy, teen pregnancy, alcohol use, crime, drug use. It's really about, as you said, that American dream, giving kids meaning in their life, opportunity, engagement with others. And it does work. I would encourage you to look at the SAMHSA prevention site and see what opportunities there are for those grants, or create them here in your own. I also will add, that's one of the reasons I think we're having so much trouble in rural America. Kids don't have the opportunity for engagement as much in rural America. We moved from Vermont to the DC area, and I can say after 10 years, not as bad as I thought it would be, but our kids were so much more engaged in that urban environment than they could possibly have been when it was 20-minute drive to the school or wherever it happened to be. So we got to look at rural America and can't leave it behind.
I think one thing that Dr. Lou said too that really struck me was one thing that we can do with our children is help them develop better interpersonal relations to overcome the ACEs in their life. And unfortunately, what's happening today with the private handheld phones and games is that interpersonal relationship is becoming with an instrument and not with their friends, not with their grandparents, not with their cousins. And I think that's something we really need to be wary of.
I also noticed that you said, Dr. Lou, something that really struck me is that in your country, when a pregnant woman gets on the bus, everybody stands up. I mean, here's somebody that's going to bring something new, bringing a new life into the world. I think we must be the only country that does not respect the pregnant woman or old people. You know? When's the last time you seen a kid get up and give you a seat on the bus, or say thank you, or say please? And I think that the family unit, not just the children, but the whole family needs help in terms of getting together and helping all of this work together, helping make what we're trying to do easier.